What if ejaculating more often could actually save your life? Because the research says it just might. 1 in 8 men will develop prostate cancer in their lifetime, and most of them have no idea that one of the most powerful things they can do to lower that risk is something they're already capable of doing and probably not doing enough of. Men who ejaculated 21 times or more per month had a significantly lower risk of prostate cancer, and those who rarely or never ejaculated had up to 271% higher risk. If you ignore what's in this video, you could be unknowingly increasing your prostate cancer risk every single month and never know it until it's too late. First, let's understand what the prostate actually does. The prostate is a walnut-sized gland that sits right underneath your bladder, wrapping around the urethra. It produces prostatic fluid that nourishes and protects sperm. Think of it like a factory, constantly producing this fluid. In many men after 40, the prostate tends to enlarge. This is called benign prostatic hyperplasia, or BPH. It's not cancer, but it can cause bothersome urinary symptoms like difficulty starting urination, weak stream, and waking up frequently at night. Separate from that, there's also a risk of prostate cancer, which increases with age, and this is where ejaculation frequency becomes important. So why would how often you ejaculate even matter? One theory is called the prostate stagnation hypothesis. When you ejaculate regularly, you're helping clear out the prostate gland, removing old cellular material, toxins, and inflammatory substances that might otherwise build up. Think of it like cleaning out a filter versus letting debris accumulate. When these substances sit in the prostate tissue for long periods, there's a possibility of more inflammation or cellular changes that increase cancer risk. Some studies also suggest that frequent ejaculation might lead to higher testosterone levels, and men with higher testosterone levels naturally tend to have a lower risk of prostate cancer. There was a landmark study published with an update in European Urology that followed over 30,000 men for nearly 2 decades. Men answered questions on ejaculation frequency in a 1992 questionnaire and were followed through 2010. Men who ejaculated 21 times or more per month had a lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. The risk was about 22% lower for men between 40 and 49, and 19% lower for men 20 to 29 when they started the study. A more recent study in southern Spain recruited about 456 men with newly diagnosed prostate cancer and 427 men without prostate cancer. They were asked about their average monthly ejaculation frequency during their 20s, 30s, and 40s. And 1 year before the interview, ejaculation frequency was grouped as 0 to 3 times per month, or more than 4 times per month. Here is the key finding. Men with prostate cancer reported ejaculating less often in the year before diagnosis. In men who had prostate cancer, only about 15% ejaculated 4 or more times per month. But in those without prostate cancer, the number went up to 26%. Men who ejaculated only 4 times had a 64% higher risk. Those who ejaculated 0 to 3 times had a 138% higher risk. And those who never ejaculated had the highest risk at 271% higher. The link was also stronger for more aggressive cancers and for men who had moderate urinary symptoms combined with low ejaculation frequency. Before you start marking your calendars, realize this is just one factor in a complex picture. Ejaculating more is not going to magically protect you from prostate cancer. You absolutely cannot neglect diet, exercise, and screenings and expect ejaculation alone to protect you.